Hi, this is Austin from Good News Pro- Good News Planet, and I'm talking to Dr. Nicholas Vogel, Vogelzang.
Vogelzang. Bird song. It means bird song in Dutch.
Oh, excellent. Vogelzang. So,
right.
What? So I hear you are doing the American Society of Clinical Oncology for like cancer.
Right. I'm the spokesperson for about 30,000 doctors and nurses, pharmacists, and scientists all around the United States and world. And we put together this year, as we always have, a group of about 20 of us, along with our staff, and we combed through all of the press releases and scientific articles and conferences and looked at what are the major advances in cancer this year that apply directly to patients. We've distilled that list down to about 50 or 54. And out of that, we picked our top 5 or 6. And it's a remarkable report. It's available on a website called www.cancer.net. And it allows people to look at all the advances made in both common cancers and less common cancers. We've seen improvements in lung cancer in terms of a pill to treat the cancer, and in terms of a study showing that CT or CAT scans can reduce the risk of development of lung cancer and allow it to be detected earlier and treated more successful. That's the leading cause of cancer death in the United States.
Excellent. So, you have lung cancer. So, what are some things you can do to try and prevent lung cancer?
Well, lung cancer is caused by cigarette smoking in the vast majority of patients, and we really want to emphasize how important it is for people to not smoke and to reduce their smoking risk. But if you are a smoker, you can reduce your risk of lung cancer by having these CT scans once a year, and hopefully the doctor can pick up the cancer early and treat it successfully.
Excellent. Well, what about breast cancer?
So breast cancer is the leading cause of cancer after lung cancer, and it's still a deadly threat to many women. We have made major advances in the use of surgery and radiation, hormones, and chemotherapy. This year, we report that a pill can reduce the risk of development of breast cancer. If your mother or your sister or family member had breast cancer, you are at higher risk, and this pill may reduce that risk quite a bit.
Excellent.
That's a relatively easy. It's already on the market. The pill is available to women around the United States and across the world.
So, I have a question. Has the occurrence of any type of cancer decreased in the U.S. or increased?
In the world of lung cancer, breast cancer, and colon cancer, as well as prostate, those are the top 4 cancers.
Right.
All of those cancers have reduced in frequency.
Nice.
The cancers that have increased are those that are from sun exposure, like melanoma has been increased. And certain rare cancers like leukemia continue to increase as the population gets older and older. And so on the average, though, we have seen a reduction in the rate of cancer and an improvement in the cure rate of cancer since the war on cancer was declared in 1971.
I see. Well, like, um, the prevention and screening, like, besides like the CT scan, is there anything else you would suggest?
Well, certainly, from my perspective, uh, having families and friends understand those four cancers: lung cancer, stop smoking and have a CAT scan;
Right.
breast cancer, have a mammogram and take your pills to prevent breast cancer; colon cancer, have a colonoscopy, monitor it if there's blood in the stool; and last, prostate cancer, talk to your doctor about PSA and early detection of prostate cancer. And those are the four big cancers. And if we could get rid of those cancers or reduce them, there would be a continued dramatic drop in cancer in the United States.
Excellent. Well, I have a question. Like, are there any therapies that we need to know about?
Yeah, for the FDA has approved a number of new drugs this year for cancer. They've approved 2 drugs for skin cancer, melanoma. They approved 1 drug for lung cancer, and they've approved a new drug for prostate cancer, as well as from a drug for other rare diseases. And this list of advances is available on that website that I told you about. From my perspective, these pills and shots really are much better than we used to use for cancer. Those old drugs were chemotherapy with hair loss and nausea. We've really made major progress in making the quality of life of patients with cancer so much better than it used to be.
Excellent. Well, I have one quick question at the end. Is what's your good news?
My good news is that my prostate cancer patients, and I see a lot of them, have really been benefited by this drug, abiraterone, or Zytiga. I have some older guys who have just been tired of radiation and chemotherapy, and this drug really makes a difference in their lives. Just a pill a day, boy, and they're suddenly feeling better again.
Excellent. Well, thank you.